Another barrier to communication can be advanced age. The size of the elderly population in the United States is increasing. The baby boomers are individuals who were born between 1946 and 1964. So in 2010, there were estimated 76 million baby boomers, and by 2030, more than 58 million Americans will be over the age of 65. So we will be working with primarily older adults. So that's the largest demographic that we work with in physical therapy. Declining health and complex disease management in the elderly result in multiple visits to the doctors and to other healthcare providers each year, which is going to require a good amount of communication. Communication can be impaired in several different ways with this demographic, such as sensory loss like vision or hearing. There's a decline in memory or slower processing of information. And the healthcare provider has to adapt their communication with elderly patients accordingly. So we have to remember that everybody learns a little bit different, and we should always ask open-ended questions and give the patient time to respond and to be able to process the information that we're giving them. Here's some strategies that we can use for the aging population. Schedule elderly patients earlier in the day. We tend to want to speak slowly, clearly, and loudly. We repeat important information and write down instructions. If the patient doesn't understand what we're talking about, repeating it may not work. We may have to rephrase what we say. We want to focus on one topic at a time and minimize distractions. Face-to-face interaction is usually the best, trying to maintain eye contact. Again, this is a cultural thing, so be aware of cultural differences as well. And the use of visual aids also tend to be very helpful. Delirium is acute confusion, and it's a temporary or reversible period of disorientation, hallucinations, or delusions. And so episodes have an abrupt onset, which is associated with specific factors or causes. Now, episodes may last for hours or days, so just kind of be aware of that as well. And patients will find it difficult to focus attention and to rest or sleep. So these are some of the things that our elderly patients can be faced with that can put barriers in front of the healthcare provider and the patient. This is also characterized by memory impairment and deficits in reasoning, judgment, abstract thought, comprehension, learning, task execution, and the use of language. It may involve a degenerative process like Alzheimer's disease, and it typically has an insidious onset that occurs over months and years. You just don't really know why, it just kind of comes on. So again, things to kind of consider when working with patients that are elderly. Here's some strategies that we can use with cognitively impaired patients. Expect an increase in confusion from the patient. So again, we want to make sure that we are clear, and we want to make sure that we're concise with our words and we're not overwhelming the patient with too much information. We always want to approach the patient from the front and call them by their preferred name. Respect the patient's personal space, and again, we have to observe nonverbal cues. How do they react when we move closer to the patient? Do they lean forward or do they retract from you? And that'll give you some information as well. We want to avoid sudden movements that may startle or irritate the patient. Also, using a slower pace when speaking and a lower pitched voice also helps It also tends to be very calming as well. Only ask one question at a time. Give one-step directions and instructions. So again, trying to keep activities as simple as possible. You always want to be mindful of your nonverbal messages as well. You never want to come across as upset or angry or frustrated with your patients. And we never disagree or argue with our patients, but we do want to educate our patients as well. So there is a fine line on how we do that. And this concludes our section on adapting communication to a patient's ability to understand.